So I'd like to show you the Lympha pants garment or appliance that works with the Optimal. This is a 24-chamber appliance, and what's really nice about it is it's very adjustable. So you can see on the sides you have the ability to choose one of these 3 zipper settings, and on the bottom there are some zippers so that you can set the heel and give the foot a comfortable dorsiflexed position. So since my model is very petite, I'm going to go ahead and set this up, and I'm going to use the smallest zipper setting. It's much easier when a patient gets in and out of this if it's zipped part way. And what I find is that I usually do it to about the knee level. So I've done this side. And I'll wait and set the heel zippers when she's actually in the appliance, because then I'll be able to conform it to her heels. I'm going to go ahead and kind of fold this over a little bit and then bring it like so. And what this will do is it will give her an easier time to climb in. I tell patients it's a lot like just climbing into a sleeping bag that has legs on it. So I'm going to bring my model in now. If she were wearing shorts or if she were barefoot, I would use Stockinette Liner to provide a barrier between her and the inside of the appliance. We do clean this between each patient. We need to sterilize it for hygiene purposes. But also, this is a cleanable vinyl that patients at home can clean with soap and water. And it's nice to have a little clothing or cloth between the skin and the inside of the appliance. So I'm going to have you sit right here on the edge of the bed. And then go ahead and just bring your feet on the bed. And bring this foot over and just in and in. And with someone who has range of motion difficulties, you can actually unzip these all the way and help them in it a little bit more. But she's pretty limber. So now you'll notice that here's where the edge of the garment is at the crotch. So I'm going to invite her to scoot down, because we want this to go all the way in perfect to the crotch. Now you can lie down, and if she were putting this on herself, she would pull the zippers up while she was still in a seated position, but because I'm assisting her, it's easier for me to assist her when she's lying down. And this is a new appliance, so it's a little stiff. Let's see. After these zippers have been used a few dozen times, it starts to be a lot smoother. As you can see, there's plenty of clearance between her axilla and her chest and the superior border of the appliance. We don't want this to cover the breasts. We don't want it to go up into the axilla. But the trade-off would be that if she had genital swelling, then we may want to unzip this a little bit, or do something so that she can get all the way in. You want to just make sure that people are positioned in a way so that this is treating them in the most optimal way. And you can put your arms down. And are you comfortable? Do you want the pillow over your head a little bit? There we go.
Thank you.
Great. Okay, so this treatment is done with patients lying down. Some of my patients who have shortness of breath or difficulty breathing, we might elevate the head of the bed slightly, but this is not very effective in a seated position. As we go down to the feet, I'm going to now adjust these zippers. And she's right in between 2 of these heel zippers. So what I'm going to do is to do the more distal zipper, kind of scrunch it, and you can kind of see how I'm just sort of putting her heel right here in this pocket. And then that will allow this part of the appliance to bend up so that her foot can be in a dorsiflexed position. It's much more comfortable to have the feet in dorsiflexion than if they're down in plantar flexion. And the pillow here can help to keep it propped up. And when the device is actually running and everything's inflated, you'll be able to see. Sometimes we'll even double a pillow. And at home, patients might do this on a couch so that the edge of the couch can kind of help to prop the feet. So I'd like to point out that there's a feature here that has a zipper, and this could be used for patients who have catheters, because obviously you don't want the catheter to be compressed underneath the appliance. We're not going to actually go through a treatment here in the interests of time, but you may want to come back and double check and look at the position of the feet and make sure her body's comfortable during the treatment. So now that we've finished treatment, I'm going to show you a few tricks, and so you can help me unzip this. And for your patients who are less mobile, a way that I like to do it is to open these all the way and go ahead and bend your knee and just set your foot, and on this side as well. And then lift your hips, and you can just easily pull it out from the patient. And that way, if they have mobility issues, it's a quick way to help them get out.
Today I'm going to be showing you how to add expanders and strap expanders to the pantsuit. The first thing you want to look at when you have the pants and the expanders is where the zipper pulls are. So the zipper pulls are always going to be facing the center of the pants. So you know that this one is going to go on the right leg here, and this other one is going to go on the left leg. Now when you first get it, you want to undo the strap right here and pull it through the D-ring, and then you want to unzip the pants all the way. And then you want to connect the ends at the base of the feet by putting in the zipper pull here and then placing the other zipper pull on the other side. And then you can zip the expander off the leg. Once you have that done, you need to add this strap expander right here, which will come with the bilateral pants expanders. If you don't do this, you won't be able to connect it into this side when it's fully inflated. It'll just basically pull it apart, or it'll squeeze too tight in the foot. So you want to add it in by slipping the strap through the strap expander here, unvelcroing this side, and putting it through the D expander towards the base of the foot. And this will allow you to have it fully expanded, and it will hold the foot up when it starts inflating. Now if you have a patient who is a bit shorter and they need to move the strap a little bit farther up the leg, they can do that by moving the strap over to this section right here. That's pretty easily done. All you have to do is unvelcro down by the base of the foot and then move it up to the more proximal D-ring right here. And then to tighten it up so that the foot is actually held up when it starts to compress, you can just tighten it by pulling on this strap right here. And that will make it nice and tight, so the foot will be facing straight up in the air once it starts inflating. Now, if you need to loosen it, you can always do that by lifting up this portion right here and pulling, and that will loosen this up. But You want to keep that nice and tight.